guys, I'm Jenny. I'm one of the EMI residents. So this is this is very much not a pediatrics topic, but it is an endocrine topic. We made some switches, but we'll get started. So this patient, 56-year-old male, presents to the ER with epigastric abdominal pain, nausea, vomiting. He just started a new medication for his diabetes. Unsure of the name, but it's not feeling well. So came in to be seen. So vitals, mostly normal, a little bit of distress due to pain. Says, hey, it hurts right here, middle of my belly. You examine him, has a little bit tender in the epigastrium, periumbilical, no rebound guarding, oriented, otherwise looks overall okay. So you take a look at his labs. Anything jumping out at anyone? I know this is a lot of text. Yeah, lipase. Yeah, that's like not normal. What else? Yeah, a little leukocytosis. What else? Yeah. Yeah, so my mild LFTs, otherwise, electrolytes look pretty good. Bicarb is normal. So we're not really thinking what for this patient. Well, what do we not think it is? Yeah, it doesn't look like DKA. And he's a guy that looks pretty well. We still don't know what medication he took, but he's like, I'm taking something, and potentially is what caused these changes. So you reassess your patient. After some Toradol, Pepsid, Zofran, he's still very tender in the epigastrium, feeling a little bit worse, and having a little bit of like right upper quadrant tenderness, not really sure. So what do you guys want to do next? Yeah, I was like, you probably saw on this patient, and we see this. What are we looking at? Yeah, yeah. This is some pain. So this is some pancreatic edema. It's always been a dream of mine to find a pancreatitis on bedside ultrasound. I have not yet succeeded, but I will say this is not a talk about that, but just a kind of fun finding is acute pancreatitis. You're going to see this is what a normal pancreas looks like on the left, and on the right side you're going to see enlarged pancreas, enlarged diameter. You can see some fluid around it. It basically just should look edematous, and so that's what this patient has. Realistically, you may not find it on bedside sono. This might be a patient you scan if they're really that tender in the epigastrium. If you're already suspecting it with a lipase, you've already sort of diagnosed it. But just so we don't look at another CT with pancreatitis. And so, so basically, we're going to talk a little bit about GLP-1 agonists. So the patient's wife shows up with a bag of his medications and pulls this out and said, he just started taking this medication 2 weeks ago. And so with kind of this pancreatitis, just to kind of start off with one of the most common, or sorry, not most common, the most concerning side effects of GLP-1 agonists as they become more popular and more prevalent in a lot of our diabetics, and as well as people who are looking to lose some weight and kind of reduce their cardiovascular risk factors. GLP-1 agonists have been associated with pancreatitis, and so the idea is that they may stimulate pancreatic. Well, actually, they do stimulate pancreatic islet beta cells and exocrine duct cells, which kind of leads to the overgrowth and smaller duct size. And so all of that sort of inflammation and stimulation overgrowth is thought to lead to potential acute pancreatitis in some cases. And so about, so GLP-1 agonists, so they're this class of diabetes and weight loss medications, as GLP-1 is an abbreviation, stands for glucagon-like peptide 1, which is kind of misleading because it's actually more, it actually decreases the effects of glucagon and increases the effects of insulin. So it's kind of a misnomer in some ways. But it basically stimulates the pancreas to produce more insulin, and works by activating the GLP receptor. And so these are just some kind of, I like this little infographic, it talks about some of the effects. And it's really helpful for us as ER physicians, because these are effects of these medications on these different organs is also going to give us a good idea of all the side effects that people might come in with as they start some of these medications. Side effects are most common in the first 4 weeks of starting the medication and when people go have escalating doses of the medications. And so we're effectively inducing gastroparesis in some of these patients because we're delaying gastric emptying. And so a lot of people may come in with like a gastritis, nausea, vomiting, and the effects of that are going to be, variable, among people. For some people, very mild effects, as you can imagine, and some people, may come in completely dehydrated, just really not able to tolerate these medications. So these are, there's a whole bunch of these coming out. And so the kind of earliest ones were approved in 2005. So exenatide, which I haven't seen around very much. I know that I had a couple patients in our clinic on Victoza that worked really well. We see a lot of people in Trulicity in our population. Ozempic is becoming very prevalent, as well as Rybelsus. So semaglutide, I believe, has now been approved by the FDA for weight loss as well as diabetes, and then and Mounjaro as well, and so which is tirzepatide, and there's actually a lot of like direct to consumer marketing as well, and patients are able to get it directly from Eli Lilly, which is very interesting, and I think we're going to see a lot more people on them, and there's been kind of some thoughts around kind of in like the primary care world that there are a lot of promising studies with the cardiovascular risk reduction with some of these medication. And I've seen, people write that was like, yeah, this is, these drugs are going to be like statins where everybody's going to be on one in the future because, the reduction in cholesterol, reducing, obesity and that kind of, those kinds of risks are going to be very effective for a lot of people. And so just to kind of run through briefly some of the adverse effects that you guys may see. I'm sure you've already seen patients with this. I know I haven't seen a pancreatitis from a GLP-1 agonist, but I've definitely seen some GI adverse effects from some of these some of these patients. And so the most common thing you can see: nausea, vomiting, diarrhea. You can have dyspepsia, constipation. People with gastroparesis can be pretty miserable. And so thinking about how you're going to treat that, just kind of knowing that people are on these, if a person's on this medication, kind of thinking through how you're going to treat that. And also just, being able to counsel your patient on that, if you started this medication, these are the expected side effects, and to kind of think about whether they can tolerate the medication or if there might be a better choice for them. And so for some diabetes medications, hypoglycemia is a pretty big concern. The interesting thing about GLP-1 agonists is that they actually do not typically cause hypoglycemia on their own, unless they're used in combination with insulin or other oral hypoglycemics like sulfonylureas. I know in our clinic, here, we typically would not prescribe GLP-1 agonists in combination with insulin. We typically take our patients completely off of insulin and then use our GLP-1 agonists alone. But I've definitely seen patients come in on both, and I think that it's a kind of provider dependent. And so the interesting thing about these is they have an insulin-tropic effect. So it kind of depends on the glucose level, because it doesn't cause direct insulin release, because you're essentially just making beta cells more sensitive to the glucose-dependent insulin secretion. And so they're pretty sort of smart drugs in that sense. And then other things you may see with all kind of the GI losses that you might see with some of these patients, a pre-renal AKI could be a very common finding. And some of these patients have kind of a low threshold to get labs like you would on any kind of abdominal pain, vomiting patient. And then there are some reports for some of these agents, acute interstitial nephritis and acute tubular necrosis. And so there are some kind of direct toxicities to the kidneys with some of these medications. And so something to sort of look out for. Hypersensitivity reactions are also common because they're synthetic peptides. And so you can also lead to kind of antibody formation. You can have allergic site reactions. And so people might come and say, I have this rash on my belly. And so it's good to kind of ask if they're injecting medications like insulin or if they're using a GLP-1, just so you kind of know where it could be coming from. And another thing that's been happening in the last 2 years or so that I've kind of seen in the literature is this rise of compounded GLP-1s. And so because of these dramatic weight loss effects and kind of their their kind of dramatic effects for diabetics as well. There's been a large shortage of GLP-1 agonists that are FDA approved. And so there's actually this mechanism by which if there is a drug shortage for a certain drug that's on this FDA shortage list, compounding pharmacies are able to, they're basically allowed to create the drug in a compounding fashion, which I'm not totally familiar with, but it looks like they basically are able to take the, they're basically able to create the drug, but in like a non-FDA regulated manner. And so what they've, but the FDA basically put out like a letter at the end of 2023 where they were concerned about some of these medications sort of being out there, not regulated. They said that a lot of these were the salt forms of the medications, not actually the active ingredients. And people are paying a lot of money for these because if you try to get some of like the injectable semaglutides, I think without insurance, already they can be up to like $1,300 a month. And so some of these services are offering things like $300 a month. And so when people are really trying to get these medications, they look credible. It looks like, they were like, this is the same thing. This is this drug. And the FDA is saying, actually, no, it's not. And be careful with these. And so it's something to sort of watch out for when if any of our patients, we're not really sure, what the adverse effects could be of this. From what I could find, mostly that it just doesn't work. But obviously we have to be concerned that if it's something else, what is it causing? And so something to kind of think about as these kind of become more prevalent and there's not really a good way of regulating them. So just a couple takeaways. As these become more prevalent, I'm just asking about new diabetic injectable medications can kind of help you counsel your patients on side effects. You're just kind of another point of contact for them within the healthcare system. They may have been started on the medication and then not really known what to expect. And so it's something to be able to discuss with them, to consider pancreatitis in these patients who are on these agents and try so that we don't miss that. And then just be cognizant the patients may be taking non-FDA approved medications and to have that opportunity to counsel them on that. And then I'm sure that there will be information about, any potential side effects that may come from these non-regulated medications. But that's all I have.